Do you have problems finding the right ENT for your referrals? Do you look at your patients very thoroughly in terms of their airway needs? It's become so popular now. It's very popular to talk about airway, to learn about airway, and most of the education that's out there is all about various appliances that may be helpful to some patients, and that's great. In pediatric dentistry and orthodontics of young people up through adolescence, oftentimes an ENT referral is not only, as the American Pediatric Association says, your absolute first treatment, but the second thing about an ENT referral is that it is absolutely possible to change everything in their airway issues and their future so that they won't become a sleep apnea patient, if you will, someone who could be diagnosed that way. So ENTs are very important in this particular area for you and for your patients. Plus, they support what you're doing. Now, as an aside, you can do expansion, which can increase airway by a lot, which is great. You can do sagittal correction with sagittal correctors, which we teach frequently and all the time and online to learn how to increase the airway that way. But you still really need to get the ENT on your team for these patients. How do you find a good ENT? You want an ENT who's interested in seeing growing, changing children. That's important. That's a question that you need to ask them. Are you interested in seeing children? May I refer you child patients with airway issues? And if they kind of hesitate or say, well, sure, I'd love to see them, then ask another question. Do you find a percentage of those patients that you get referred, because those are already patients with some kind of signs and symptoms in their pattern, do you find that a good percentage of them have some kind of needs that you can address? If they say, well, no, we usually wait till they're about 12 to 15, and then if they're still having problems, scratch that one off your list. Why? Because that's not an ENT who really wants and understands that they can change the growth, the development, and the long-term future for that patient. You want one who really understands how important it is to change things, to change the growth from adverse to healthy, from adverse to good. That's what you want. So ask those two questions. And then send one patient who you know has needs. And if you've already identified huge tonsils, or if you've already identified that they have bedwetting, snoring, mouth breathing regularly, whatever it may be, open bite, low forward tongue, and it's not the frenum alone or at all, that patient could go to the ENT and see what happens. If the ENT finds the reality of the fact that maybe the tonsils are part of the problem, maybe the adenoid tissue is part of the problem, if they actually are able to pick up on that or to go with you on that, then yes, now you have someone that may work out to be really good for your patients. So to find the right ENT is to find someone who wants to treat children, who understands about growth and development and the long-term effects of changing things now, because that's huge. We don't need any more adult sleep apnea patients, do we? And finally, you want to find one who actually does respond. And of course, then you want to be sure that they're delighting the parents and the patients in their overall approach, and that they're happy when they come back and say how nice they were and how good they were. Because again, the parents don't know how good you are at what you do. The parents don't know how good that ENT is at what he does. So they're looking for someone to be loving and kind and wonderful to them. And if they're delighting you in their response to your patients, you just might have found the right ENT. Hope this helps, doctor. You have a great day. I love you.